Hello, you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I help you become aware and sensitized about the different surgical conditions. Today's video is about ulcers due to frostbite. It is another one of my videos that I dedicate to all the people that are currently residing or are planning to relocate to areas that experience the winter seasons. By definition, ulcers due to frostbite are fundamentally deep ulcers that result from prolonged exposure to freezing temperatures, typically temperatures below 0.55 degrees Celsius. And this results into the death and the destruction of the cells and the tissues in these areas. What happens is when you get exposed to the freezing temperatures, you tend to get a narrowing of the blood vessels that bring blood from your heart to your extremities. That is the toes, the feet, the hands, the fingers, the lips, the nose, and the ears. But commonly and essentially, it is your upper and the lower limbs. The other thing that can happen is you will actually have a reduction in the supply of blood and oxygen in those areas. So the cells and the tissues will die off because they cannot survive without oxygen. After some time, they will get eroded and then you form an ulcer. The other thing that can happen is you will have a redirection, a pooling of blood from the extremities to the more vital organs of your body. For example, your brain, your kidneys, your liver, your lungs, and your heart. And when this happens, of course, it will cause a reduction in oxygen supply in these areas, and the cells will die off and then get eroded and will form an ulcer. The other thing that can also happen is that when you have a pooling and a redirection of blood away from the extremities, you tend to have cooling of these areas, the extremities, a drop in the temperatures in these areas. And this can cause a freezing of the fluids in these areas. For example, the fluids within the blood vessels, around the cells and within the cells. And you end up with what we call formation of ice crystals. Ice crystals cause further damage and severe damage to the already assaulted cells of your body. And of course, these cells are going to get eroded and will form an ulcer. So that is the picture of what happens in ulcers due to frostbite. When it comes to the signs and symptoms, they come in phases. The first phase is what we call the early stage or the frost nip. When this happens, you get pain and cooling of the areas. For example, you're out there and you're in an environment that is freezing, you're going to start feeling pain and cooling of the areas that have been exposed. You're also going to get numbness, stiffening, and tingling sensations, also pins and needles in those areas. If you do not extract yourself from this environment, you're going to transition to another stage. The other stage is called the superficial frostbite or the intermediate stage, where you're going to have some skin changes. For example, your skin is going to become reddish and also blistered. And the blisters usually contain fluid, clear fluid. But also these areas are going to become swollen and frozen and hard and stiffened. If you do not separate yourself from this environment, your areas are also the affected areas are going to transition to another stage, the late stage, or what we call the deep frostbite. And here you're going to have an involvement of the deeper layers of your body in the exposed areas. For example, your muscles, your tendons, your ligaments. You're also going to have blistering of the skin, but this time round, you're going to have blood-filled blisters. And after some time, these blisters are going to be replaced by a thick black scab. And just underneath that, you're going to have new skin formation or new tissue formation. But sometimes you can just have dead tissues. Yeah, that is what happens. That is the picture of the signs and symptoms that you should look out for. When it comes to the risk group of people, the people that are prone to getting this condition, people that are involved in winter sports, for example, skiers, mountaineers, people that work in harsh conditions, for example, soldiers, security guards, sailors, the very young and the very old also get this condition. People that inherently have arterial disorders, for example, Raynaud's phenomenon, diabetes mellitus, atherosclerosis, peripheral arterial disorders, people that use drugs, drug users, drug addicts, alcoholics, smokers, they tend to end up with this condition. When it comes to the diagnosis is essentially clinical. We usually do what we call history taking and clinical examination. In history taking, we ask you a very important question of whether you have been exposed to freezing temperatures, because that is the number one predisposing factor. And if the answer is yes, then you're a candidate of a frostbite injury. We also take your temperatures to make sure that you don't have a reduction in the temperatures of your body. If it is less than 35 degrees Celsius, we assume, or actually we just diagnose you with hypothermia. When it comes to the clinical examination, we look at your body to look out for the signs and symptoms that I've told you about, but also the predisposing factors that I've told you about. Any signs of you having any arterial disorders and any other things I've told you about in the predisposing factor conditions. Yeah, so essentially that is what we do, and I am going to split this video into two parts, because I want to make it more digestible for you. I don't want it to make it long. Thank you so much for listening to me. Thank you so much for those of you that have liked my videos. Please share my videos, continue sharing my videos, continue watching my videos, and I'll see you in my next video.